Welcome to this video on the differential diagnoses and clinical reasoning of the respiratory system. In this video, we will explore common diagnoses that present with respiratory symptoms and how to identify lethal lung diseases instantly. Also, we will discuss how a comprehensive evaluation can help identify the underlying cause of a patient's symptoms. So let's kickstart. Our first diagnosis is pneumothorax. Pneumothorax is a condition where air leaks into the pleural space, causing the lung to collapse. It is often sudden and can be caused by trauma. Pneumothorax is common in young, tall, thin males. Basketball players are usually affected. Symptoms include sharp pain that worsens with breathing in, coughing, and shortness of breath. Pulmonary embolism is a serious condition where a blood clot blocks a pulmonary artery. It occurs when a blood clot gets lodged in the arteries of the lungs, obstructing blood flow. This condition can be life-threatening, and prompt diagnosis and treatment are crucial. Symptoms of pulmonary embolism include sharp chest pain that does not radiate, dry cough, and sometimes blood in cough, hemoptysis. Pulmonary embolism is closely related to deep vein thrombosis, DVT, and patients may experience discomfort lying flat and fainting when sitting upright. Acute pulmonary edema is characterized by the accumulation of fluid in the lungs, usually as a result of left heart failure. Symptoms include a large volume of clear sputum, which may be watery with a pink tinge or pink frothy sputum. Coughing worsens when lying down, and there is no chest pain. Chronic obstructive pulmonary disease, COPD, is a progressive lung disease that makes it difficult to breathe. Smoking is a significant risk factor for developing COPD. Symptoms include a chronic cough lasting more than 3 months, wheezing upon waking up in the morning, coughing up sputum, and shortness of breath. Sputum may be mucoid, clear, or gray, and the first product of sputum in the morning may be green. Asthma is a chronic respiratory condition characterized by recurrent episodes of wheezing, breathlessness, chest tightness, and coughing. Patients may wake up at night with wheezing, and wheezing may worsen with exercise or cold air. A dry cough that is worse at night is also common. Sputum may be mucoid, white, viscid, or yellow, and eosinophils may be present. Atopic asthma is triggered by allergens such as pollen, house dust, pets, and cold air. Non-atopic asthma may be triggered by a previous respiratory infection, drug-induced, or occupational factors such as fumes and dusty workplaces. Severity of asthma can vary, and treatment typically includes medications such as oral steroids and salbutamol. Family history, especially childhood asthma or parental asthma, may increase the risk of developing asthma. Pneumonia is a common lung infection that can cause inflammation in the air sacs in one or both lungs. Symptoms of pneumonia include pleuritic pain, fever, shortness of breath, and cough. The cough may start dry and then become productive, mucus-producing, with rust-colored sputum in the case of pneumococcal pneumonia or green sputum in the case of Klebsiella pneumonia. Patients may prefer lying on one side, typically the healthy side. Pulmonary tuberculosis is a bacterial infection that mainly affects the lungs and can spread to other parts of the body. The symptoms of pulmonary tuberculosis include chronic cough, breathlessness, evening fever with night sweats. Productive, mucus-producing, cough with blood and unintended weight loss. Other risk factors include a history of overseas travel, antibiotic resistance, and HIV infection. It's also important to ask about living conditions and whether anyone the patient knows has the same problem. The next condition we will discuss is lung cancer. The symptoms of lung cancer include a bovine cough with shortness of breath, hoarseness, blood-streaked clear sputum for more than a week, as well as appetite and weight loss. Risk factors include asbestos exposure in the workplace, smoking, and a family history of lung cancer. In addition to these symptoms, it is important to note that bone pain indicates malignancy. Bronchiectasis is a chronic condition that affects the airways in the lungs. Patients with bronchiectasis often present with a chronic cough that is very productive, producing a large amount of sputum that is purulent, green, and sometimes smelly. Intermittent hemoptysis or coughing up blood may also occur. These symptoms can be exacerbated by infection, which can lead to fibrosis and further respiratory complications. It's important to perform a comprehensive systemic review of the patient's symptoms. The patient's weight loss, fever, allergies, and medication compliance should all be considered. Drugs, such as beta blockers and NSAIDs, can cause bronchoconstriction and wheezing, are contraindicated in patients with asthma and COPD. ACE inhibitors can also cause coughing. Past medical history, including hospitalizations, surgeries, and long-standing illnesses, can also provide important clues to the underlying cause of the patient's respiratory symptoms. These long-standing illnesses can be asthma, any previous respiratory infection, hypertension, hypercholesterolemia, and diabetes. Additionally, a family history of genetic disorders or cancer may also be relevant to the patient's diagnosis. Important diseases to look out for are cystic fibrosis, asthma, COPD, pulmonary hypertension, and sarcoidosis. Finally, social history provides important insights too. Social history, including smoking, alcohol use, occupation, living conditions, and travel history, can also provide valuable information. It's important to address patients' ideas, concerns, and expectations. Understanding what matters to them can help to provide better care, build trust, and improve outcomes. In conclusion, clinical reasoning involves analyzing symptoms like shortness of breath, chest pain, cough, hemoptysis, and wheezing, which are common in our differential diagnoses. Conducting a systemic review, and taking past medical, family history and social history are crucial in determining the diagnosis. Always remember to address any ideas, concerns or expectations the patient may have to ensure the best possible care. Thank you very much for watching. Please do subscribe for our next video on the Differential Diagnosis and Clinical Reasoning series.